Hi, my name is Catherine Bockenberg, and I'm a Montana State University nursing student, and I'm doing a quick presentation on CBD, the potential uses of it, the studies, the controversies, and the political changes. I just moved here from Washington State, where marijuana is legal, and Montana State, it is not legal, and that's what first triggered my interest. So the pharmacology behind CBD, it is a derivative of cannabis sativa, and so is THC. THC is the psychoactive component, and CBD is the non-psychoactive component. The endocannabinoid system was first discovered in 1990, and they've discovered two different receptors. The CB1 receptor is most abundant in the brain, and it is correlated with cognition, memory, locomotion, and pain transmission. Endocannabinoids are the compounds synthesized in animals and humans that have affinity for CB receptors, and they're synthesized on demand primarily after a stimulus triggers an increase of intracellular calcium. The physiological functions of the endocannabinoid system include synaptic plasticity, mood, memory, movement, food intake, pain transmission, immune functions, GI motility, energy balance, bone development, blood pressure, and fertility. There are many studies about the potential uses for CBD, some including anxiety, cancer, pain, multiple sclerosis, HIV, ALS, Parkinson's disease, seizures, and many more. So currently, there are 3 million people in the United States living with epilepsy, and 1 million are living with uncontrolled seizures. Dr. Jacobson and Porter of Stanford University conducted a survey to determine the effects of CBD on those with epilepsy. They did their survey on children ranging from 2 to 16, and they had results of 84% reporting a reduction in their child's seizure frequency, and additionally better moods, improved alertness, and improved sleep. So we're going to watch a quick video of a father giving his son CBD oil during a seizure.
There you go, buddy. There you go.
So despite the studies that have been going on, there's still a lot of controversy about the use of CBD with epileptics. A survey done by Epilepsia, a medical journal, they conducted a survey asking the following questions: the sufficient safety of CBD, the efficacy data, if the responder would advise trying medical marijuana in case of severe refractory epilepsy, and if pharmacological grade compounds with CBD should be available. So the graph on the left shows that epilepsy specialists and neurologists were the highest percentage, believing that there's insufficient safety data, and then the graph on the right shows that, once again, the epilepsy specialists and neurologists were the least likely to advise using medical marijuana and CBD in those experiencing severe catastrophic epilepsy who have not responded to approved therapy. In the last month, the FDA approved Epidiolex for Lennox-Gastaut syndrome and Dravet syndrome, which are both seizure disorders, and Epidiolex is the first cannabis-derived drug that has been approved for medical use. Dravet syndrome is a rare genetic condition appearing during the first year of life with frequent fever-related seizures, with myoclonic seizures developing later. and Lennox-Gastaut begins in childhood with multiple types of seizures. Both syndromes have they experience learning problems and intellectual disabilities. And approving a drug for these syndromes allows for uniform strength and consistency of medical delivery by medical providers. The impact on nursing practice is that we will now be seeing CBD prescribed, and we're going to need to know what it is, what it's used for, and its side effects such as diarrhea, sleepiness, decreased appetite, and vomiting. And here are my references. Thanks so much.